the disease of the bone known as fibrous dysplasia. We will be discussing this disease under the following subheadings. We will discuss about the introduction, we will discuss about the etiopathogenesis, we will discuss the classification, we will discuss the clinical features, we will discuss the radiological features, we will discuss the histopathology, and finally we will end up with the treatment modality. So what is fibrous dysplasia? Okay, fibrous dysplasia is an uncommon, non-hereditary developmental anomaly of the bone due to an defect in the osteoblastic differentiation and maturation. Okay, any bone in the body can be affected by this disease. Okay, and the primary defect lies in the replacement of the bone by fibrous tissue, in which secondary metaplastic bone formation occurs. So coming to the etiopathogenesis, the exact etiology of this disease is unknown. However, the recent studies have shown us that there is a genetic mutation in GNAS1, which is guanine nucleotide binding protein alpha stimulating activity polypeptide gene, which is located on the chromosome 20. This gene, it codes for G protein, which is involved in the production of cyclic AMP. But when this gene is mutated, usually there is overproduction of the cyclic AMP. Overproduction of the cyclic AMP or cyclic adenosine monophosphate, it leads to the effect on the differentiation of the osteoblast, which leads to the bone lesions which we see in fibrous dysplasia. Other than the osteoblast, this overproduction of cyclic AMP has also effect on the melanocytes. Okay, so there is increased proliferation of the melanocytes, which will lead to the cafe au lait spots formation in this disease. Okay, and then we also see hyperfunction of the affected endocrine organs, okay, which will give rise to precocious puberty, hyperthyroidism, growth hormone, and cortisol overproduction. If the mutation of this gene occurs in the early stages, then it will affect all the three tissues like bone, melanocytes, and the endocrine glands. Okay, but if the mutation occurs in the later stages of the zygote, then it may involve only few bones or bones of the other bones of the skeletal system. Coming to the classification of fibrous dysplasia, we classify fibrous dysplasia into basically monoosteotic type and polyosteotic type. Now we will discuss each of them in detail. Okay, usually the common age of occurrence for fibrous dysplasia is around 3 to 15 years. Males and females are commonly affected. There is no racial predilection. We use the term monoosteotic fibrous dysplasia when there is involvement of only one bone. First we will discuss what do you mean by monoosteotic fibrous dysplasia. We use the term monoosteotic fibrous dysplasia when there is involvement of only single bone. Compared to polyosteotic dysplasia, it is more common and it is a less severe form. It can involve any bone in the body. It can involve ribs, femur, tibia, craniofacial bones, or the humerus. Most commonly, it presents in the form of a slow growing painless swelling. As you can see in this picture, it's a picture of the maxilla where you can see a large swelling occurring on the left side of the posterior part of the maxilla. So when the maxilla and the associated bones are involved, okay, the patient usually has a typical leonine appearance, which is also called as leontiasis ossea. In this picture, you can see a patient who is suffering from this type of fibrous dysplasia, and the patients are showing a leonine appearance. Coming to the polyosteotic type of fibrous dysplasia, we use the term polyosteotic when there is involvement of more than one bone or there is involvement of multiple bones by this disease, and its severity ranges from involvement of few bones to involvement of almost all the bones in the skeletal system. Here the bones which can be involved are femur, tibia, pelvis, ribs, skull, etc. And the disease can affect unilaterally or one side of the bone, or sometimes it can affect both the sides of the bone. Usually in the polyosteotic type, we see bone pain and spontaneous fractures. Other than that, the long bones of the body, they may show bowing and they may show leg length discrepancies. Sometimes the femurus, it shows curvature at the neck and the proximal shaft, which gives rise to the characteristic shepherd crook deformity. This is one of the pathognomonic features of fibrous dysplasia. In this picture, you can see the shepherd crook deformity of the femur. Coming to what are cafe au lait spots. Cafe au lait spots are nothing but the cutaneous pigmentations which are seen in some of the patients of fibrous dysplasia. It is seen in more than 50% of the patients. Usually it is present at birth or it may precede the occurrence of the body lesions. It is seen on the same side as that of the lesions of the bone. It may be present on the skin over the midline of the body or on the lower back, shoulder or the neck. This is how the cafe au lait spots appear on the skin. Other than the bone lesions and cafe au lait spots, there is abnormality in the endocrine systems also. So we may see precocious puberty, or we may see hyperthyroidism, we may see adrenal disorders, diabetes or hyperpituitarism. Coming to the syndromes associated with fibrous dysplasia. The first one is called as JAF's type or Jaff-Lichtenstein's syndrome. If polyostic fibrous dysplasia is seen with cafe au lait spots, then we use the term JAF's type or Jaff-Lichtenstein syndrome. Then we have one more syndrome called as Mazabrod syndrome. When intramuscular myxomas occur with polyostotic type of fibrous dysplasia, we call it as Mazabrod's syndrome. Then we have the most important one is your McCune-Albright syndrome. When polyostotic fibrous dysplasia, cafe au lait spots and endocrinal abnormalities are seen together in a patient, then he is suffering from McCune-Albright syndrome. Coming to the special type of fibrous dysplasia, which is called as the craniofacial fibrous dysplasia. This term is used when the disease is limited to the craniofacial bones alone without the involvement of the other bones of the body. Even though multiple bones are involved, this is considered to be a form of monoostotic fibrous dysplasia. And most of the cases of craniofacial fibrous dysplasia are seen within the first 2 decades of life. And usually the patient presents with a painless swelling of the associated bones. Sometimes frontal bone, sphenoid are the commonest bones involved. The patients may also complain of headache or orbital pain. Coming to the oral manifestations or the features which we see when there is involvement of maxilla or mandible. Usually the first clinical sign will be the painless swelling of the associated bone. Other than the swelling pain, we may also see deformity of the affected bone. And the swelling, most of the times it involves the buccal or the labial plate of the bone. Very rarely it involves the lingual plate. This is a picture of a patient suffering from fibrous dysplasia where he is showing the bony swelling of the posterior part of the maxilla. Sometimes there may be involvement of the mandible. When there is involvement of the mandible, there may be protuberant excrescence of the inferior border of the mandible. In this patient, you can see that left side of the mandible is affected by fibrous dysplasia. And sometimes we may also see malalignment, tipping or displacement of the teeth. And because of the endocrinal disturbances, there may be delayed eruption of the teeth associated. And the mucosa which is covering the bone lesion is usually intact. Coming to the fibrous dysplasia of the maxilla, it is a comparatively serious form than the fibrous dysplasia of the mandible because it has marked predilection, or it occurs most commonly in a younger age group, and the treatment usually requires a radical surgery. Coming to the radiographic features, the lesions of fibrous dysplasia usually appear as a radiolucent lesions in the initial stages. They can be unilocular or multilocular, and sometimes they may also show scalloping. These lesions may also show a thick sclerotic border which is called as the Rin sign. But the mature lesions of fibrous dysplasia, they show radio-opaque spicules within the radiolucency, which gives rise to the characteristic ground glass appearance or PUD orange or orange peel appearance. So this is a radiograph which is showing the ground glass appearance of the bony lesions. Okay, this is another radiograph which shows the orange peel appearance which is classically seen in the fibrous dysplasia. And the periphery of the radiolucency is usually ill-defined, and it appears to blend to the surrounding norm, which is in contrast with another fibrous lesion called as ossifying fibroma, where the lesions are usually well demarcated from the adjacent normal bone, whereas in fibrous dysplasia the lesions usually merge or blend into the normal surrounding bone. And there is radiographic thickening of the skull base is also seen in fibrous dysplasia. Coming to the histopathology of fibrous dysplasia, usually histologically we see numerous irregular C-shaped trabeculae of woven bone which are not connected to each other, and the background shows a low to moderate cellular fibrous stroma. There is no relation to the functional pattern. In this histopathological picture, you can see numerous small bony trabeculae scattered, and you can see a cellular background of fibrous connective tissue. Advanced lesion, they show the bony trabeculae, okay, which give rise to the classical Chinese letter pattern seen in the fibrous dysplasia, and the intervening fibrous connective tissue shows mononuclear cells like which resembles fibroblast and progenitor osteoblast, okay. And typically osteoblastic rimming of the bony tubercle is absent in fibrous dysplasia, which is in contrast with the ossifying fibroma, where we usually see osteoblastic rimming of the bony tubercle. Coming to the treatment, there is no specific treatment for fibrous dysplasia. Usually the disease is self-limiting and it ceases to grow at when the patient reaches puberty. The monostatic form usually involves, the treatment for monostatic form involves involving the jawbones is usually deferred, and it is usually limited to cosmetic surgery. Whereas if there is a polyostotic type of fibrous dysplasia, the patient usually requires a multidisciplinary approach, as he will also be suffering from endocrinal abnormalities. In patients where surgery is contraindicated, vitamin D and bisphosphonates are useful in resolving the bone pain. And generally radiotherapy is not advised in fibrous dysplasia because of the occurrence of sarcomas in these patients. So there can be malignant change in fibrous dysplasia. It is usually around 0.4% in monostatic type, and it is around 4% in the McCune-Albright syndrome. The malignancies which are commonly seen in fibrous dysplasia are osteosarcoma, fibrosarcoma, chondrosarcoma, and malignant fibrous histiocytoma. The references for this are Schaeffer's textbook of oral pathology and Neville textbook of oral pathology. Thank you.